welcome back to my channel. My name is Deanna Tikhonov and I'm a women's health nurse practitioner. And on today's video, I'm going to be talking with you ladies about periods being heavy and how to handle that, what's normal, when it's concerning, and like I mentioned in my last video, I'm here to talk about the different issues that can go on with our periods that I know we don't really like to talk about. It's not an easy conversation to have. It's so taboo, but this is a normal process that happens every single month for us. And it's a shame that we aren't able to openly talk about it. And I know it could be challenging to find the right person to confide in and also to get true information. If you have a GYN provider out there that you feel that you're able to connect with and talk with, that's amazing. And I know that there are GYN providers out there, whether it's a doctor, midwife, or nurse practitioner, that are amazing. But unfortunately, you can't say that across the board. And I understand sometimes that it could be challenging to find someone that you really connect with. So I urge you out there, if you have had not so great experiences with a provider and kind of are discouraged, keep trying. They are out there, I promise, and it's important that you have someone you could connect with and be able to talk about these kinds of topics regarding your body. So as far as heavy periods go, there are women out there that just have heavy periods. That's the way they've been their whole lives. And what makes it, quote unquote, a heavy period? So it's a little bit subjective of what is heavy to you as an individual. From a medical standpoint, we usually say that if you are soaking through one pad in less than an hour, fully soaked front to back, not just changing it because you just feel uncomfortable, but it's truly soaked front to back in less than an hour, and you're going through pads like that hourly, that is too much bleeding, and it's very important that it's addressed of what's going on. Whether is it a structural issue that's causing your bleeding from things like fibroids or endometriosis, or is there something hormonal going on? Is it a medication that's causing it? Do you have a bleeding disorder that could be impacting this? And so it's very important that if that is the case for you, that you're going right to the emergency room or calling your GYN provider and letting them know right away, and not just going through that at home. That's a lot of blood to be losing in such a short period of time, and it could cause you to become anemic, could make you lightheaded or dizzy. So really, really important that if that's the kind of bleeding that's going on, to please go in and get urgent care right away, whether it's in an emergency department or at your provider's office if possible. So, in between that, there are women that just have a really heavy flow for days and days and days during their period. And, it's something that sometimes is just kind of overlooked, and you're like, oh, well, this is just how I am, and this is what happens. But, it can cause women sometimes to miss school, to miss work, to miss functions. Usually what's accompanied with heavy bleeding is very painful cramps. And the reason that is that actually when you bleed, your body releases prostaglandins in the body, which are the chemicals that produce cramping and pain. And so if you're bleeding a lot, then likely you're going to have the cramping and the pain. So it kind of goes hand in hand, and a lot of times this can impact your daily life and affect things that you can do and not do when it comes to your period if this is going on. So I can't stress enough that it's not something you have to just live with and just deal with. I think some women have this conception that well, my mom has heavy periods and my sister has heavy periods, so I do too, and that's just the way it is. And because if it's impacting your daily life, then it's something that's important that's addressed to make sure, one, that there's nothing medically going on that's causing this, and two, if there's something we can do to help fix that. So from a medical standpoint, it's important that you see a GYN provider if you're having very heavy periods impacting your life, or of course, like I mentioned before, soaking through a pad in less than an hour. For sure, you should go see somebody in person right away. But things that could be done to kind of check and see what else could be going on is blood work to check your hormonal levels. They may also want to check to see what your hemoglobin is, which would kind of tell if you are anemic, if you're in an anemia range, and then sometimes iron is needed in that case. Depending on how much bleeding you're having, And if you may have other symptoms such as like your gums are bleeding easily when you brush your teeth, or you find that you bruise really easily, or you've had a history of like very heavy nosebleeds in the past, these could all be indicators that you might actually have a bleeding disorder. And this is something that commonly gets overlooked as a potential cause for heavy periods. So it's important that you go to a provider that really thoroughly looks into your entire history to see what different things could be causing your symptoms. Besides checking blood work, another great tool that should be used to kind of evaluate why you might be having these heavy periods is an ultrasound, a pelvic ultrasound that is done sometimes vaginally, transvaginally it's called, and abdominally. Really, by doing both of those modalities, both of those techniques, we're able to best see your uterus and your fallopian tubes and your ovaries best and see all the structures that we need. Now, sometimes for different reasons, the transvaginal is not the best option, particularly if you have never had intercourse, you're young, you're just uncomfortable with that idea. You as the patient always have the control, and if you ever go somewhere where they tell you differently, please just find another office, find another ultrasound imaging center, because it is your body. You should never feel forced into doing something that you are not comfortable with and that is causing you pain. And it is possible to do it abdominally. Like I said, sometimes we don't get the best imaging, but we can get something, and your comfort and safety is the most important thing, that you feel safe and comfortable with whatever exam you have done. So yes, both are usually done together, but don't get scared away and think, oh, well, I don't want a vaginal ultrasound, so I'm not going to go see my provider because I don't want to do that. You know, it's important to have open communication with your provider and kind of voice these concerns if you have them, so you can come up with a meeting, an agreement together, meeting kind of halfway to find something that will work, where we can assess what's going on, but also make sure you feel comfortable. So an ultrasound is a great way to check structurally to see if there's any other structural abnormalities that could be causing this heavy bleeding. So I mentioned fibroids. So fibroids are benign growth. So benign means non-cancerous, so they're not harmful in the sense of causing any kind of cancer, but they are growths that can occur and grow in your uterus. Sometimes they're going inside the uterus, sometimes they're going outside of the uterus, and they can cause heavier periods with more painful periods, sometimes painful sex. But there are some women that can have fibroids their entire life and never even have a clue that they have them, because not all women with fibroids will have heavy bleeding and cramping. It tends to do with the size and where they are and how many. Some women could have one very small one that wouldn't even cause any symptoms whatsoever, but the more you have and the larger they are, the more likely you are to experience symptoms. So again, I have women that go their entire lives, and for whatever reason, maybe they have an ultrasound for something else, and then they find, oh, I have fibroids. And in those situations, there's truly nothing wrong. We don't really do anything for those women, because if you're not having symptoms, it's completely harmless and something we just leave alone. But if you're having symptoms like the heavy periods and painful periods, and it's really important, and we determine that you have a lot of fibroids, it's important that we address this. So there's different ways of addressing fibroids, and a lot of it too has to do with your pregnancy goals and where you see yourself with pregnancy and how old you are at this point when this is an issue, because that can play a role for sure as well. So, you know, generally we do use birth control quite a lot to help reduce the bleeding when women are experiencing this. And the progestin IUD is a great option for women if you're not planning a pregnancy and you really need reduction of bleeding and pain. The progestin IUD is actually FDA approved for women who have heavy bleeding and painful periods. So this is a great option for women in those scenarios. But studies have also shown that diet and exercise also can play a role in reducing the amount of bleeding, and I'll go into that in a future video and at more length, and how that can impact, how fibroids can be impacted in those situations as far as your diet and exercise routine with fibroids. Besides lifestyle change and medication, third option is surgery, which we always try to do as a last resort. We don't like to jump to that, especially if you're thinking of pregnancy. Surgery might not be the best option for you because it can impact pregnancy in the future. There's different kinds of surgeries. Again, as a nurse practitioner, I don't do surgery. That's kind of the main difference that distinguishes myself from doctors, so I'm not going to get too into that. But generally speaking, there's different surgical options that include something called a myomectomy, where the doctor removes the fibroid itself, and this really is, women are a candidate for this only if the fibroid is in a certain location of your uterus that doing a myomectomy would be feasible. It's not always an option depending on where the fibroid is located. Another option is doing something called an ablation, where the doctor is cutting off the blood supply to the fibroid. Fibroids are fed through hormones and from blood kind of flowing to that area and keeping it from growing and staying there. So the idea is that if we cut off the blood supply, that then the fibroid will start to shrink. That has its own pros and cons and effects with pregnancy as well. So again, it's not something that we jump to right away, and you really need a thorough consultation with a doctor to talk about this. The third option, which is always last scenario, is a hysterectomy, which involves removing your uterus where the fibroids are. This is usually reserved in women who have tried all other options and it just has not worked for them, that they're done having children, and that it's affecting their life to the point where they just want them all gone. And so that is a major surgery that has to be done in order for that to happen, to have your uterus removed. So that's why it's really reserved for last resort. Years ago, this was actually one of the first options that was given to women who had fibroids and heavy bleeding. Thankfully now that is not the case. It's something that we try to reserve it after trying all different other options first, and really avoiding that if possible, because it's major surgery, and depending on your age, it can also cause you to go into early menopause. So, it's not something we just want to jump to. And if you have any provider who kind of pushes you into anything that you don't feel comfortable with, it's so important. I recommend getting a second opinion. Every one of us as healthcare providers has different experiences, different education, different approaches, and you need to feel comfortable with the approach that feels right for you. And there is nothing wrong at all with getting a second opinion and really kind of deciding for yourself and trusting your gut of what seems right for you. So those are kind of the different things that are used to help treat and manage heavy periods. And it's important, again, that if this is affecting your day-to-day life, that you do see a GYN provider in person and talk about this at more length to really see if this is something that is nothing, if it's, and a big part of this too is how it impacts your daily life. But definitely if you're having days and days of heavy bleeding associated with feeling very tired, weak, lightheaded, go see a GYN provider and just get this looked at more at length. I do want to mention that with the copper IUD, and I did talk about this in the IUD video, but the copper IUD does have the potential for making periods heavier with more cramping. And it's something that, although it's a common side effect, it's not something that I recommend women just deal with. If it is affecting your daily life and you are like debilitated in bed with heavy bleeding and pain, get it out. It's not something to just deal with and suffer through. I think, unfortunately, that's something as women where we have a pretty high pain tolerance overall, I think, and just what we are used to kind of just dealing with. And it's something that if this is impacting you and making you feel miserable, then speak up. Speak up, and if you feel like your voice isn't heard, find someone who hears your voice, because your voice matters and your body is trying to communicate with you something. So yeah, with the copper IUD, I can't stress enough that if you've given it a try, it's been over 6 months, you're experiencing this heavy bleeding, soaking through pads regularly, less than an hour, and a lot of pain, that you might want to consider using another method altogether. Sometimes even I have women that they didn't know that they had fibroids, and it turns out that they did, and they have the copper IUD, and that's kind of why their bleeding and periods were exacerbated. So it's not something I recommend ever if patients do have fibroids to have the copper IUD put in because of that association. So this is an overview of heavy periods and when it's something that should be addressed, and what kind of tests are used, and what kind of things you can ask your provider if you can have done, and really just have that open dialogue and communication with them so you have the power over your visit, over your body, and making sure that communication is fluid between the two of you. It's so important that it's not just a one-sided conversation where your provider is just kind of telling you this is what we're doing and you don't have any say. And if you don't have the knowledge, then how can you really have your voice heard? So this video can be used so that when you go into that visit, you can have suggestions and just openly talk to your provider about different tests that you think you would benefit from and see what they think about that. So thank you so much for watching. I look forward to my future topics. Don't forget to like and subscribe to my channel. Comment below any questions, any clarifications, or topics you want me to talk about in the future. And I look forward to talking in my next video. Bye.